and welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan. Cardiogenic shock to increase the risks of myocardial infarction. Cardiogenic shock is a life-threatening condition in which one's heart suddenly can't enough pump blood to meet their body's needs. The condition is most often caused by a severe heart attack, but not everyone who has a heart attack has cardiogenic shock. In a recent study, the prevalence of cardiogenic shock in non-ST elevated myocardial infarction has increased twofold, while in-hospital mortality has decreased during the study period. The study findings are published in the American Heart Journal, and the study concluded that the use of coronary angiography and percutaneous coronary intervention increased during this particular study period. Stress and nighttime elevated blood pressure a serious concern. Sleep is the most crucial factor for maintaining health. People under stress and blood pressure problems have a lot of trouble while sleeping. In individuals with regular sleep-wake patterns, highest blood pressure occurs during the daytime while one is awake, and the lowest blood pressure occurs during the nighttime while asleep. A study in the American Heart Journal Plus Cardiology Research and Practice has revealed that reduced blood pressure, dipping or elevated nighttime blood pressure are associated with increased risk of adverse cardiovascular events. Psychological stress is associated with abnormal diurnal patterns of blood pressure. Drugs like cocaine and heroine to affect the resting cardiovascular function. Cocaine and heroine cause increasingly a rise of modest variance in resting bradycardia and the QT interval. Clinicians should first consider demographics and recent use of tobacco, alcohol, and cannabis before assuming cocaine and heroine affect these measures, according to a study in the International Journal of Cardiology, Cardiovascular Risk and Prevention. The findings concluded that cardiovascular disease has been increasingly linked to regular use of substances such as cocaine and heroine, but other demographics like tobacco, alcohol must also be considered for better evaluation. Family history linked to occurrence of stroke. Previous studies report paternal or the sibling stroke was associated with an increased risk of offspring stroke. Whether family history of cardiovascular disease predicts the risk of stroke recurrence still remains unclear. A post-hoc analysis in the Journal of Stroke and Cardiovascular Diseases has found out that family history of cardiovascular disease, that is either a history of coronary heart disease or stroke among the first-degree relatives, that is including parents, children or siblings, that is from the same parents, were at an increased risk of stroke recurrence even under primary, secondary prevention treatment. Genetic similarity in COVID-19 variants increases the risk of pregnancy hypertension. COVID-19 has created a havoc all around the world, continuing with much higher complications. Hypertension is the most prevalent comorbidities in patients with COVID-19, with a very high mortality risk when comparing with the non-hypertensives. It has been not long since the break of COVID-19, and the long-term effect of this virus in hypertension disorders, specifically in pregnancy, may not be reflected clearly as yet. However, a study in the Pregnancy Hypertension, which is an international journal of women's cardiovascular health, provided direct evidence that there is a shared genetic predisposition to that patients infected with COVID-19 may be casually associated with an increased risk of hypertension disorders while during the pregnant period. That's all for today. Stay safe.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.